Neuroplasty is the decompression or freeing of intact nerve from scar tissue, including external neurolysis and or transposition. Neuroplasty, digital, one or both, same digit. Nerve of hand or foot. The physician releases a compressed nerve in a digit of the hand or foot. The physician makes an incision overlying the nerve. Surrounding tissues are dissected from the nerve, freeing it from scar tissue or adhesions. The incision is repaired in layers. One or both of the digital nerves in a single finger or toe are decompressed. Neuroplasty, major peripheral nerve, arm or leg, open, other than specified. Sciatic nerve. Brachial plexus. Lumbar plexus. Repair is accomplished by decompressing the nerve from the surrounding tissue. Neuroplasty and or transposition, cranial nerve, specify. The physician frees an intact cranial nerve from scar tissue, neuroplasty, or moves an intact nerve to a new position, transposition. The physician makes an incision overlying the nerve, dissects it free of the surrounding tissue and, if necessary, moves the nerve to a new position. If the nerve is in bone and must be decompressed, freed, or moved, the overlying bone is first removed using drills and or osteotomes. Neuroplasty and or transposition, cranial nerve, specify. The physician frees an intact cranial nerve from scar tissue, neuroplasty, or moves an intact nerve to a new position, transposition. The physician makes an incision overlying the nerve, dissects it free of the surrounding tissue and, if necessary, moves the nerve to a new position. If the nerve is in bone and must be decompressed, freed, or moved, the overlying bone is first removed using drills and or osteotomes. Neuroplasty and or transposition, ulnar nerve at wrist. The physician decompresses or transposes a portion of the ulnar or median nerve to restore feeling to the hand. The physician makes a horizontal incision in the wrist at the metacarpal joints and locates the nerve. In 64719, the ulnar nerve is located and freed. Soft tissues are resected and the nerve is freed from the underlying bed. Care is taken to ensure tension is released and the incision is sutured in layers. Neuroplasty and or transposition, median nerve at carpal tunnel. In, the median nerve is decompressed by freeing the nerve inside the carpal tunnel. Decompression, unspecified nerve, S, specify. Plantar digital nerve. The physician decompresses a nerve. In 64722, the nerve is unspecified. In 64726, the nerve is located at the base of the foot and supplies sensory fibers to one of the toes. The physician makes an incision in the area of nerve tension and locates the nerve. Surrounding soft tissues are dissected from the nerve to release pressure on the nerve. Internal neurolysis, requiring use of operating microscope. Neuroplasty includes external neurolysis. The physician makes an incision over the affected nerve and locates the nerve. The physician resects the nerve sheath parallel to the fibers and releases scar tissue within the nerve. Cranioplasty for skull defect, up to 5 cm diameter. Larger than 5 cm diameter. The physician incises and retracts the scalp. The bone flaps are lifted and remodeled. A prosthesis may be used to reproximate the bony edges. The skull is stabilized and the scalp is reproximate and sutured in layers. Cranioplasty for skull defect with reparative brain surgery. The physician reshapes or reconstructs the cranium in addition to reparative brain surgery. The physician incises the scalp above the defect area. A bone flap is raised and the physician inspects the dura and the underlying brain. Any dural defects are corrected. The bone flaps are reshaped, reproximate and stabilized. The scalp is sutured in layers. Cranioplasty with autograft includes obtaining bone grafts up to 5 cm diameter, larger than 5 cm diameter. Incision and retrieval of subcutaneous cranial bone graft for cranioplasty. The physician incises the scalp above the defect area. The scalp is retracted and the defect is located. The physician incises the cranium and reshapes available skull bone. The physician obtains bone grafts from the patient. The harvested bone is reshaped to supplement the cranium. The bones are approximated and stabilized. The scalp is reanastomosed and sutured in layers. Report if the surgeon reassesses the surgical site of the cranioplasty and retrieves the bone graft used, whether autologous or from another source. Keratoplasty, corneal transplant, anterior lamellar. The physician removes the round layer of corneal tissue, threads it with sutures, and sets it aside. The trephine is used to repeat this process in the cornea of the patient, removing the defective corneal tissue. The donor cornea is of similar diameter and thickness as the removed tissue. The donor cornea is positioned with the prep-laced sutures and additional sutures secure it to the cornea. The physician may use a saline or air injection into the anterior chamber during the procedure. When the procedure is completed, the speculum is removed. Antibiotic ointment and a pressure patch may be applied. Keratoplasty, corneal transplant, penetrating, except in aphakia or pseudophakia. Penetrating, in aphakia. Penetrating, in pseudophakia. Endothelial. The physician removes the disc of corneal tissue, threads it with prep-laced sutures, and sets it aside. A metal ring may be sutured to the sclera of an aphakic patient to stabilize the operative field. The defective cornea of the patient is removed with the trephine. The donor cornea is positioned with sutures and additional sutures secure it to the cornea. The physician may use a saline or air injection to restore proper intraocular pressure. 65,730 is for those patients who still have a natural lens. These patients are phakic with lens. Is for those patients who have had cataract surgery. These patients are aphakic without lens. Is for patients who have an artificial lens. These patients are pseudophakic without natural lens. Otoplasty, protruding ear, with or without size reduction. The physician makes an incision on the posterior auricle and raises the posterior skin off the cartilage. A new antihelical fold is created with multiple sutures through the cartilage. Some techniques employ limited cartilage cutting. A small ellipse of posterior skin is removed and the skin is closed with sutures. Packing corresponding to the anterior ear contours is placed. The size of the auricle may be reduced. Laryngoplasty, surgery confined to drumhead and donor area. Through the external ear canal, the physician visualizes the tympanic membrane and the eardrum defect. The edges of the eardrum perforation are roughened, rimming the perforation. Some dissolvable packing may be placed through the perforation into the middle ear space. A fat graft plug may be placed in the perforation or a piece of fascia may be placed medial to the eardrum over the dissolvable packing. A tympanomeatal flap may be raised. Any incisions are sutured and a dressing is applied.